Welcome back, science enthusiasts. You've tuned into Dr. Strange's channel, your one-stop shop for unraveling the mysteries of the human body. Here, we make medical education not just easy, but also engaging and fun. We're about to embark on a fascinating journey today, diving deep into the microscopic world inside us. We'll explore the intricate dance between oxygen and hemoglobin, and how they work together to keep us alive and kicking. Stay tuned as we delve into the intriguing topic of the oxygen-hemoglobin dissociation curve. Buckle up, let's unravel the mysteries of life, one molecule at a time. Have you ever pondered how oxygen journeys through your body? Well, the answer lies in the miraculous molecule called hemoglobin, and a fascinating concept known as the oxygen-hemoglobin dissociation curve. Imagine hemoglobin as a taxi for oxygen, picking up passengers in the lungs and dropping them off at various tissues throughout the body. The oxygen-hemoglobin dissociation curve, a sigmoidal graph, illustrates this ride. It shows the relationship between the partial pressure of oxygen and the amount of oxygen bound to hemoglobin. As the partial pressure of oxygen increases, more and more oxygen hops into the hemoglobin taxi until it reaches a maximum saturation point. Beyond this point, even if oxygen lines up in droves, our taxi can't take any more passengers. However, this curve is not fixed. It can shift to the right or left based on certain factors such as pH, temperature, carbon dioxide concentration, and 2,3-bisphosphoglycerate concentration. Now, what do these shifts mean? A right shift in the curve indicates a decreased affinity of hemoglobin for oxygen. The taxi driver becomes a bit picky, making it easier for oxygen to get off at their respective destinations. This right shift typically happens when your tissues need more oxygen, such as during vigorous exercise. Factors that can cause a right shift include an increase in carbon dioxide concentration, a decrease in pH, or increase in acidity, an increase in temperature, and an increase in 2,3-BPG. On the other hand, a left shift indicates an increased affinity of hemoglobin for oxygen. Our taxi driver becomes clingy, making it harder for oxygen to disembark. This left shift often occurs when your body is at rest or at high altitudes where the oxygen levels are low. Triggers for a left shift include a decrease in carbon dioxide concentration, an increase in pH or decrease in acidity, a decrease in temperature, and a decrease in 2,3-BPG. To summarize, the oxygen-hemoglobin dissociation curve is a vital tool in understanding how oxygen is transported in our bodies. The right shift and left shift depict the dynamic nature of this process, influenced by various factors. The right shift, with decreased affinity, ensures oxygen is delivered to tissues when needed, while the left shift, with increased affinity, helps conserve oxygen when supply is low. In this scene, we're going to explore some real-life implications of the oxygen-hemoglobin dissociation curve. How does understanding this curve help medical professionals? Well, it can provide critical insights into a patient's oxygenation status, especially in cases of respiratory or hematological disorders. For instance, in conditions like anemia or chronic obstructive pulmonary disease, COPD, the curve could shift, affecting oxygen delivery to tissues. By understanding these shifts, doctors can devise appropriate treatment strategies. Also, athletes often use this knowledge to improve their performance. High-altitude training, for example, can trigger a right shift, enhancing oxygen delivery during intense exercises. So, not only does the oxygen-hemoglobin dissociation curve explain a biological process, but it also has significant practical applications in healthcare and sports science. So, the next time you take a deep breath, remember the fantastic journey of oxygen in your body and the crucial role played by the oxygen-hemoglobin dissociation curve.